Bismillahirrahmanirrahim. Dear students, let's talk about the depolarizing block or non-competitive depolarizing blocking agent or neuromuscular blocking agent. So this is lecture number 27. So in this lecture we will talk about the different type of depolarizing blocking agent non-competitive. So Succinylcholine have affinity and submaximal intrinsic activity at nicotinic and muscarinic receptor. They open the sodium channels which cause initial twitching and fasciculations. Fasciculations are muscle twitching. It is a small local involuntary muscle contraction and relaxation visible under the skin arising from the spontaneous discharge of a bundle of skeletal muscle fiber and muscle fascicles. It doesn't dissociate rapidly from the receptors, resulting in prolonged depolarization and inactivation of sodium channels take place. Neuromuscular blocking agents, first one is non-depolarizing agent, that is also called competitive blocker. So the mode of actions or mechanism of action of neuromuscular blocking agent, these have an affinity for nicotinic receptor at the muscle end flates that have no intrinsic activity. The antagonism is surmountable by increasing the concentration of acetylcholines, which is the neurotransmitter. These are the skeletal muscle relaxants which are given here in the tables, and this is the durations of the skeletal muscle relaxants like Pancuronium. Its normal duration is 40 to 80 minutes. Pancuronium is 50 to 100 minutes. Butrycholinesterase is almost from 20 to 40 minutes. Acetylcholine is its normal duration of action is 20 to 40 minutes. It starts its pharmacological action. Rocuronium is 20 to 40 minutes. Sccinylcholine is 3 to 6 minutes. Skeletal muscle relaxants are depolarizing blocker non-competitive. Succinylcholine, so it causes muscle pain. It also causes hyperkalemia and malignant hyperthermia maybe occurs. Now these are the agents. So one is competitive non-depolarizing and the second one is non-competitive depolarizing agent. So competitive non-depolarizing agent cause paralysis and placids, new stigmine. So the competitive non-depolarizing agent, it can also antagonizes the effects of, you can say, new stigmine. The competitive non-depolarizing agents, these are the classical examples. Pancuronium, it also comes under the category of competitive non-depolarizing agents. Non-competitive depolarizing agent cause fasciculations and placid. It can exaggerate and no effect is produced, while Sccinylcholine is the classical example of non-competitive depolarizing agents. The skeletal muscle relaxants, the clinical uses of neuromuscular blockers, they are adjunct in general anesthesia, especially they are used during intubations and endoscopies technique and brief procedures. Skeletal muscle relaxants, they can directly acting muscle relaxants. So directly acting muscle relaxants, the example is dantrolene. Dantrolene is depolarizing trigger release of calcium from the sarcoplasm, make contraction and blocks, is blocked or reduced. As we know that dantrolene is used orally as well as intravenously to reduce the spasticity and the hemiplegia and cerebral palsy. It is a drug of choice for malignant hyperthermia. So dantrolene is a drug of choice for malignant hyperthermia. If a person who is hyperthermia, so dantrolene, it is the best choice and it can be recommended. Dantrolene, as we know that it is a diuretic acting agent, a diuretic acting muscle relaxant. It can reduce the skeletal muscles strength by interfering with excitation, contracting, coupling into the muscle fiber by inhibiting the release of activator calcium from the sarcoplasmic stores. It is very useful in the treatment of malignant hyperthermia caused by depolarizing relaxants, and this drug can be administered orally as well as intravenously. Oral absorption is only 1/3. The half-life of this drug is 8 to 9 hours. It can be classified into two categories. One is depolarizing and non-competitive type, and non-depolarizing or competitive type. So depolarizing or non-competitive type is succinylcholine, which consists of two acetylcholine molecules that link back to back by acetate methyl group. Its mechanism of action is just like acetylcholine, because so it can stimulate the cholinergic receptor again engine, nicotinic, ganglionic and muscarinic autonomic site to open the ionic channel, leading to depolarization. The metabolisms of succinylcholines, so they are take place. The effective dose is 0.8095, 0.512, 0.63 milligram per kg. The onset of action is 30 to 60 seconds. The duration of action is 9 to 13 minutes. It is one of the succinylcholine is the shortest acting neuromuscular blocking agent. When succinylcholine it is metabolized, so after that the metabolized product is butyrylcholinesterase or plasmacholinesterase or pseudocholinesterase. Metabolism of succinylcholine. So succinylcholine are broken down by butyrylcholinesterase produce one succinyl monocholine and succinic acid and choline 2. At neuromuscular junction, the effect of succinylcholine is terminated by diffusion. Now, what are the factors which affecting the metabolism of succinylcholine? So, as succinylcholine is entered the circulation and rapidly metabolized by pseudocholinesterase. This process is so efficient that only a fraction of injected dose ever reaches neuromuscular junction. The duration of action is prolonged by high dose or by abnormal metabolisms. The abnormal metabolism may result from hypothermia, low enzyme level and genetically aberrant enzymes. Now these are another factor, contributing factors which can affect the metabolism of succinylcholine. Hypothermia, it can decrease the rate of hydrolysis. A low level of pseudocholinesterase accompanying pregnancy, liver dysfunction, renal failure, neostigmine and perineum's advance age burns and oral contraceptives. Obese and myasthenia gravis, resistance to succinylcholines. Especially 1 in 50 patient has one normal and abnormal gene, resulting in a slightly prolonged block 20 to 30 minutes. 1 in 3,000 patients have two abnormal genes, homozygous atypical, which will have a very long blockage, for example 6 to 8 hours. Prolonged paralysis caused by atypical cholinesterase should be treated with concentration mechanical ventilation until muscle function should be normal. These are the qualitative analysis of butyrylcholinesterase. So Dibuchan's number, it is amide based local anesthetic that inhibit the normal butyrylcholinesterase by 80% and the abnormal enzyme by 20%. Fluoride numbers. These are the side effects which are reported in the form of cardiovasculars. So cardiovascular effects are given here that can increase or decrease the blood pressure and heart rate due to stimulation of the parasympathetic and sympathetic ganglia. Bradycardia may be occurs and as well as the DT stimulations at the sinoarterial node by succinyl monocholines. More common in unatropinized children and digitalis and beta block patients. Other side effects they are also reported. It may be in the form of hyperkalemia, increase the potassium level. Normal short lasting rise in potassium 0.5 to 1.02 mmol per liter. This life-threatening condition when the potassium level elevate possible, and burn injury, massive trauma and neurological or muscular disorder. These are the side effects which are reported. Fasciculation may be occur, muscle pains may be occur, intragastric pressure elevations may be occurs, and intraocular pressure elevation occur, while the malignant hyperthermia potent triggering agent in the patient. So these are the susceptible to MH, and the prolonged paralysis may be occur. These are the side effects which are reported. Intracranial pressure, it may be elevated in the cerebral blood flow. Intracranial pressure in some patient, it can be prevented by preventing with NMT or with IV lignocaine 1.5 to 2 milligram per kg body weight, 2 to 3 minute prior to any intubations. Indication of use of succinylcholine is rapid sequence of inductions. Succinyl recommendation for uses, it is used in treatment of peripheral neurostimulator. So its maximal dose is 1 to 1.5 milligram per kg body weight. Look for recovery before administration of NMDRs, neuromuscular blocking agents, and do not treat with anticholinesterase unless the proper NM monitoring is available. Spontaneous recovery of Succinylcholine TOF is documented, and cholinesterase is administered first. Now these are the depolarizing neuromuscular blocking drug classification on the basis of chemical structure. So look at here, there is benzyl, isoquinolinians, quinoliniums, and this one is detubicurers, mutocurines, and doxacarium, atracarium, and cisatracariums, and muracarium. Aminosteroids, pancuronium, and ripacuronium, these are the drugs. Non-depolarizing neuromuscular blocking agents. Look at here, these are the ultra short acting classification of non-depolarizing muscle relaxants. Ultra short acting, short intermediate acting. So ultra short is ripacuronium, that is 28043. Mevacurium is this is short non-depolarizing muscle relaxant, while the intermediate is vicurinium, atracurium, cisatracurium, and ricuriniums. The long acting as pancuronium and detubicurers, galamine, and mutocurines, and doxacurium, and peripherally. These are the non-depolarizing muscle relaxants. Pancuronium is best quaternary aminosteroid NMJ blocking agents, non-depolarizing muscular blocking agents. So it's actually the effective dose is B70 microgram per kg body weight. So the onset of action is 3 to 5 minutes. Its duration is 60 to 9 minutes. Dosage intubation is for intubation 0.08 to 0.12 milligram per kg body weights. Its maintenance dose is 0.04 milligram per kg body weight. This is long acting non-depolarizing muscle relaxants. No or slight increase of blood pressures, vagolytics, hepatic metabolism, and renal clearance, dose reduction, and failure in histamine release may be occur. Vicuronium, it is another aminosteroid, so its effective dose is B50 microgram per kg body weight. The onset of action is 3 to 5 minutes. For duration 20 to 35 minutes. Dosage intubation is 0.8 to 0.12 milligram per kg body weight. Its maintenance dose is 0.4 milligram per kg. Infusion is 1 to 2 microgram per kg per minute. Depends primarily on the biliary excretion and secondaries on renal excretions. No dose reduction required. Intermediate acting ectometabolites are 3-cis-vicuronium responsible for prolonged effect. Prolonged effect in old age, for example, obesity, renal failures, in you can say adverse AIDS, acquired immune deficiency syndrome, and obesity may be occur. Inshallah, and my next lecture I will discuss about the atracarium, and inshallah onward, and I will proceed my lecture inshallah. And thank you so much.